Hello, my name is Chayeve, and I will be presenting on incivility in nursing. So, the American Nurses Association defines incivility in nursing as rude or aggressive behavior, whether it comes from patients or coworkers, um, s- or even workplace incivility when there are behaviors that are nonverbal illusion, humiliation, gossiping, subversion, verbal disrespect, and or physical violence. And nursing instability happens because of workplace stress and poor training, which hurts patient care and creates unhealthy work environments. So nursing schools and hospitals need programs to teach new nurses how to treat each other respectfully. Think about when you go to a hospital and nurses don't get along. They either argue or ignore each other or just act very rudely. And this doesn't just affect the nurses, it affects patients too. And this definitely happens more often than we think. Um, I'm going to read this statement right here. The opposing argument is that some people also believe that nurse incivility is just part of a high stress job and that nurses should just learn to handle it on their own. But that's not um, but that is not something that is a root cause of incivility. In order to understand why the root cause is incivility, it's important to understand the essential steps towards finding effective solutions. So, understanding why the contributing factors to nursing incivility are workplace stress and the lack of proper training. So, together, these conditions can create an environment where people um, and are acting rudely and unprofessionally, and it becomes more frequent. And that's also due to causes from workplace stress, starting with lateral violence when peers act badly towards each other, or even not having the proper training. Um, Acting very offensively with their body language, bad mouthing each other in the workplace, and gossiping about each other. This increases stress for the nurses, lower job satisfaction, and even contributes to burnout and high turnover rates. And I'm going to read this quote right here. The consequences of incivility, such as its impact on teamwork, patient safety, and staff retention, highlights the urgency of addressing the issue. Incivility directly affects patients. When there is miscommunication among between nurses, when someone is afraid to speak up or ask questions, and the patient care nurses are so worried about their own emotional stress versus worrying about patient care. An example from this is a report that I read upon that shares experience of a new nurse that was put in this department and automatically was already having getting disrespectful behavior from somewhere higher up, and it really shows the impact. Even though it didn't affect this new nurse, everyone else around us saw that this new nurse was treated badly, given more patient census to work with, and then given like just the most work there is. Um, and there's a quote that also comes from this study, this article that I read. It says, when it came to the room assignments, scheduling patient assignments or breaks, there was no doubt who the least favorite nurse on that unit was. So nursing incivility is definitely predictable, preventable. When it comes to nursing programs, they are where it is where nurses are trained first. They can be trained besides clinical work, then the clinical education that they are trained on. They could also be trained on communication, teamwork, and how to address conflict. Healthcare facilities are also a big place where it can be prevented by offering ongoing trainings, behavior policies, and strong mentorship to new nurses as they come on board. And an example that shows that it was a study that was done in the emergency department where new nurses were um, separated into two groups. One was a control group and one wasn't a control group. And the control group was able to receive intervention when there were conflicts happening. And this really shows that it does impact and it can make changes when nurses have that support. Another quote right here: incivility seems to be multi-faced, faceted phenomenon that is affected by various variables such as a time, gender, relationship model, organizational culture. So those are the resources that I used in creating this PowerPoint. Thank you so much.